Hi, and welcome back to Becca Babbles podcast. I'm your host, Becca. I'm a certified personal trainer, holistic health coach, and future chiropractor on my way to figuring out this thing we call life. Now, let's get babbling. Hi, everyone, and welcome back to Becca Babbles podcast. Today, I have a really exciting episode all about red light therapy. I feel like red light therapy has been this hot topic for the past year or so, which is really exciting, but there's also a lot of misinformation out there, and sometimes it's hard to tell what is real and what is not. And you hear people talking about, like, it's good for your skin, it increases mitochondrial health. And then you try and go down the podcast rabbit hole of understanding red light therapy, and then people use all these big words, and you're like, I don't even know what's happening right now. And then you just skip across and be like, well, I will just try and buy the $20 Amazon red light therapy unit that I think may or may not help me. And then you may or may not be wasting your money. If this is you, you should definitely listen to this podcast, because Dr. Carl, who is on the podcast with me today, will break down in an easy, digestible way of understanding red light therapy. He has his own company where he's made red light therapy units that are the true red light that will actually help with your skin, your brain health, your recovery and performance. He's got so many videos on YouTube talking about people getting benefit from his units, and he just doesn't make them. He actually truly understands the science. He was a professor, and he talks all about it in an easy way to understand it, which I really appreciate, because for someone who likes understanding things with science but sometimes don't understand the words that people are talking about, he makes it easy to understand. So like I said, we dived into everything red light therapy and how it works, understanding the science in an easy, digestible way. We talk about how red light therapy is being used for anxiety, depression, brain health, all the fun things. We also talk about how it will help clear your skin, recover faster, and allow you to have better sleep. It's not just hype, it's real science. We also, because of course I am a chiropractor and he is a chiropractor as well, I wanted to hear a little bit about his journey and his story about becoming a chiropractor, and then slowly transitioning into becoming an author and creating his red light therapy company. So you're definitely going to want to stay tuned and listen. If you want to connect with Dr. Carl, he's got an Instagram, a YouTube, a book. You're definitely going to want to check this one out. I've been diving into it recently, and it's been really fun to just learn more about how red light works and the different types of red light and the benefits of that. We will dive into that into this podcast, so you'll get a little sneak peek of that. And he's also got a website. So if you want to connect with him, all of those will be linked down in the description below. And with all that being said, I can't wait to babble with you next time. Dr. Carl, I'm so excited to have you on the podcast. You want to introduce yourself to everyone?
Yeah, sure. I was telling you earlier as we were talking that it was 1972 when I decided that and I was a junior at Stony Brook University out in Long Island, a very good school, and trying to decide what I wanted to do. And I happened upon chiropractic. And my feeling back then, I was kind of my version of a hippie, which is more about helping people than it was about making money. I don't mind making money, but really that core is helping as many people as I possibly can. And that was basically my mantra also. Uh, and that was my intention. And what I did when in 72 is I started calling chiropractors all over the country. And I never found one that wasn't thrilled to be a chiropractor. And that was important to me, to find these people that were excited about waking up in the morning and going what we'll call work, but it really wasn't work. It was more fun and play and whatever you want to call it. And I knew that's what I wanted to do. Eventually I became a chiropractor in 1978. And I had 12 practices in that period of time, and I absolutely loved it. And then about 20 years into my practice, which is about 27, 28 years ago. So I've been a chiropractor for about 48 years, give or take. So about 27, 28 years ago, I was introduced to light therapy. And there was a relatively famous orthopedic surgeon out of USC out here in California. And he hands me this thing that looks like a flashlight. And he says, come with me and we're going to save the world. And I thought he was crazy. Of course I thought he was crazy. I mean, shining a light on someone is going to make a difference. Are you kidding? By that point, I thought I knew everything. I'd been in practice already 20 years and I didn't believe him, to be honest. But I was willing to give it a shot. And wouldn't you know, it revolutionized my practice. I was able to heal things I never believed possible. This lady had gum disease, helped her. This person had kidney problems, helped him. This guy had a ripped Achilles tendon. It was 75% ripped. He needed surgery. We sent him to the orthopedic surgeon for the surgery, but that was the beginning of the week, and they couldn't, they scheduled the surgery for the end of the week. And so I told the guy, well, why don't we try this light that's really new? The only thing we knew for sure is that it couldn't hurt anybody. I said, why don't we do this every day and then see what happens? What it should help is make you a little bit better prepared for the surgery. And when he went for the surgical review later on that Friday, late in that day, it was obvious that he did not need the surgery. Give an idea why orthopedic surgeons are not thrilled with this whole thing. So, that's when we started realizing that there was something really powerful here. Then, and that was a class 1 device, and we were involved with class 2, class 3, class 4 devices. And then about 14 years, give or take ago, it was discovered totally by accident that there was an element of light that I was not using that could help in shrinking fat cells. In other words, losing weight. And you and I both know that weight loss in this country is huge. I mean, it's bigger than anything. I don't care what other thing that a chiropractor, a medical doctor, anyone wants to advertise. I think weight loss is bigger than all of them. And so I started getting involved with manufacturing when I found that out. We were the first company to integrate all kinds of different lights to bring about the success. And, the beauty of it is, and I'm going to go over the mechanism in just a moment, but it was amazing that we were able to have this success without damaging any tissues. It's totally non-invasive. And you hear about non-invasive other devices, but they're really non-invasive in that they're not surgically, but they are still killing fat cells, like ultrasonic cavitation, radio frequency, cool sculpting, or whatever. I don't want to use the name. Freezing the fat is what I'd rather say. All these are about destroying fat cells. And with this element of light, it doesn't destroy anything.
Mhm.
It just encourages the fat that's stuck in the fat cells out of the fat cells and eventually to the liver for use or elimination. We're going to talk a little bit more about that in a moment. Yeah, so I started manufacturing and we were having a great experience. We had over 400, 500 offices that were doing this. And then COVID hit. And a practitioners wanted less physical contact between the patient and the provider. And so we developed a bed. And it basically, I wish I could show you the picture that normally would be behind me, but it ain't there. So it's a bed that has a top canopy and a lower bed. So the person gets in the bed and lowers the canopy onto them. And it was just going to be a replacement for what we had been creating up to that point. But the point was that you don't need staff. The person can get in and out of the bed themselves. No one has to put anything on them. And because it's so safe, you don't need anybody in there supervising. And even so, the person owning that equipment does not necessarily have to be a health practitioner. In order to be successful, you want to know a little bit about the body, or something about the body, but that's about it. And it was, again, just going to be a replacement for what we had manufactured up to that point. But what we learned, remember, in the 50 years that they've studied this technology, there has never been a recorded side effect. You couldn't hurt somebody if you tried. So at worst, it'll happen is nothing. But what we started to learn is that when you bathe the whole body, head to toe, front and back, left and right, inside and out, at the same time, that's when you're getting the miracles. Before that, we were having very nice results. My shoulder hurts, now it doesn't. My elbow, whatever. But now, and fat loss with the pads and things that we were making. But now we're starting to get the miracles. What's the miracles? Dementia, Parkinson's, Alzheimer's, multiple sclerosis, rare hereditary diseases, autoimmune diseases, Lyme disease, any kind of neuropathy, any musculoskeletal problems are a slam dunk. But they were a slam dunk with the lasers and all the other stuff that we were manufacturing up to that point. Rheumatoid arthritis. We had a lady that had a stroke. And after 8 sessions, and the stroke was devastating, and after 8 sessions, she was better than before she ever had the stroke.
Interesting.
So I'm trying not to make claims. What I feel like I'm doing is reporting the news. Just happens to happen. And someone will say, well, it's anecdotal and you have to have proof. We got tons of proof, and we're going to go over that in just a second. I mean, can you imagine, giving you an example, when I do live lectures in front of an audience where they can raise their hand and all that sort of stuff, I might ask them the question of, what would you do? If you're not a health practitioner, I want you to pretend you are. If you are, just listen. What would you do if someone called you up and said, I'm having a heart attack once, if not twice a week, and this has been going on for 12 years? So 12 years ago, give or take, they had implanted a defibrillator into this gentleman's heart, into his chest. So every time he died, it would zap him back to life. But by the time we met him 12 years, 13 years in, he was on his last leg. He had no energy. He was highly depressed because he used to be an athlete before this, and now he's dying. He literally was a mess. What would you do? If you're an orthopedist, if you're a chiropractor, if you're a cardiologist, if you're an acupuncturist, what would you do?
Yeah.
Well, obviously no one had an answer. Their answer was implant the defibrillator, which, by the way, is not contraindicated with our bed. But no one had an answer. They just were watching him die, to be honest with you. So the practitioner calls me up and says, look, I got a guy coming in tomorrow. He's having these regular heart attacks. I'm not sure I should even treat him. I mean, imagine he has a heart attack in my office. What am I supposed to do? I said, look, we're just going to treat him for 5 minutes. Normally a dose is 12 minutes. Just treat him for 5 minutes and stay in the room the whole time. And that patient goes home that night, and that was 2 years ago, by the way. He's had more treatment, but he's never had another heart attack since. Come
That's
on.
crazy.
I mean,
Yeah.
holy mackerel. What do you think? In 1972, when I was thinking I want to help a lot of people, I didn't realize I was going to be helping them to that extent. And what we're hearing more than ever is the phrase, thank you for giving me my life back. I love it. I absolutely love it. So when you have a guy like Steve that contracted Lyme disease when he was 12, it ruined his life. We didn't meet him until he was in his 50s. So 40 years of no energy, 40 years of a variety of many different symptoms. Some days were much worse than others, but he was a mess. It ruined his childhood, it ruined his social life, it ruined his education. Of course, he had no career. He wasn't dependable enough because of his illness to even show up sometimes. So he wasn't a great, he's going to get mad at me for saying this, but he probably wasn't a great employee. And then he gets in our bed. And this is one of those goosebump periods. When I'm talking to him, I am doing my best to just shut up and not say anything because what he's saying is unbelievable. And I'm not even going to tell you anymore than to tell you that I'm going to send you a bunch of videos, including this one with Steve, including the one with Arnett was having the regular heart attack, and including the one with Jessica. Now, Jessica, when I sent me a note saying, well, I had Lyme disease and now I'm doing much better. It was a little bit more involved with that. That was it. But I called her up to find out more of the story and do a testimonial with her. And wow, I had no idea. She had 16 very serious conditions. She spent most of her life going to doctors, getting injections, taking drugs. One of the injections was they would inject her in her eye because she had uveitis. And once a month, the only answer they had for that was shoot her in the eye, which was devastating. And because of this uveitis, it's a swelling that if it's left unchecked, she's going to, the person would go blind. So they had to do something, right? So she starts with red light therapy, and she went from 180 pressure, which is supposed to be 12. She went with 180, and within 2 weeks, that pressure was down to 12 and has remained there. So she doesn't need the injection. She doesn't need the drops that cost her $400 a month copay. I'm just giving you of her 16 very serious conditions, including 20 years of diarrhea, including Lyme disease also, including 3 forms of psoriasis, including guttate psoriasis, plaque psoriasis, and psoriatic arthritis, that she would wake up many mornings wake up in the morning with what's called dactylitis, which is like sausage toes. Her toes would be black and blue, enlarged, and very painful. And after 2 visits, that stopped. But all the 16 things that she was bothered with, including kidney stones, including migraines, I mean, it just goes on and on. Thyroid, liver, all that stuff, they're all stopped. I'm not just telling you this because, whatever. I'm jazzed about this. And so here's my challenge to everybody. I tell when I do these lectures in general, I say, look, you no longer can complain. That's it. I don't want to hear it anymore. You go in, get 6 visits. Now, I'm not in practice, so you can't come and see me. I want you to go for 6 visits. That's 3 times a week for 2 weeks. A dose is 12 minutes, so it just takes 12 minutes, 3 times a week for 2 weeks. And at the end of the 6th visit, I would be shocked if we didn't see a difference. Now, you may have such a horrific problem. We have some people with very tragic issues that it might take, probably take longer. But most people, the worse off they are, the more they will see a change within those 6 visits. So I talked about stroke. We talked about heart attacks. We talked about liver, kidney, thyroid, eyes, mouth, anything, even hair restoration. Skin is going to look phenomenal. So at any rate, I'll send you those videos because they are, to me, earth-shattering. For someone like myself, if you like to help others or yourself, you want to watch these videos. And then if there are 2 reasons to buy one of these beds. They're expensive. I'm not going to say they're not. But the reason why people will sit there and go, oh, that sounds like a lot of money, because they do not recognize how expensive it is to be sick. If you're young, I'm 73 years old. If you're young, you have no clue what it means to be, what it costs to be sick. It's not just the actual cost of the drugs and the hospital stays and doctors and all that. It's also your lost life. Your quality of life is worth a lot. And having a higher quality of life is very important. So I challenge you, all of you, just get 6 visits. In fact, the way to do that is you go to the website, trifectalight.com. And I'm going to send you these information for the show notes. And you go there, you go to the Contact Us page. On the left side, it says, find an office closest to you. We find an office closest to you. We can't list all of them for privacy reasons, but we can find a location closest to you. Go there for 6 visits. Call them up and tell them that you heard us on this podcast and tell them that I said they need to give you a really great deal for those 6 visits. And do it. Get those 6 visits. And if you don't see a change, I would be very shocked. I don't care what you got. I don't care what part of your body it's involved. And so we're going to go in just a minute. Why is it everywhere? Why is every part of your body subject to healing with this type of technology? And so it's important for you to realize that there are people who are very skeptical and they think it's snake oil. They think it's I had the most difficult type of career people I have to speak to, besides orthopedic surgeons who hate this thing, is your psychologists and they all think it's placebo and all that. I said, well, you tell Arnett that has had hundreds of heart attacks and now is not having any heart attacks, that it was all in his head. Yeah, you go ahead and call him up, tell him that. That's a bunch of baloney. So at any rate, with that said, I'm going to take a breather. I'm going to let you ask. I know you're dying to ask me a question or two, but remember what I am going to go over is the mechanism. What is the mechanism?
Yeah. And I would really appreciate you going into exactly like why it works, how it works, because I know it kind of sounds like this genie in the bottle sort of thing. And it's like, if this was such a powerful device, why isn't more people talking about it? I know it's getting a little bit more popularity, but it's like, if it's doing
Why do
all
you
these
think,
things.
knowing what we know,
Yeah.
seeing how it works, why don't you think it's at every wound center? Because if you have a 3rd-degree burn or a serious wound, we're going to heal it in a fraction of the time that it would take otherwise. So we had this lady with 3rd-degree burns, and she was guaranteed 6 months of pain, 6 months of drugs, and permanent scarring. And by the end of the 2nd week, the pain was gone. By the end of the 3rd week, it was gone. So why wouldn't every wound center have something like this? Or why wouldn't every OR have something like this? Because right after surgery, if you get in this bed, the healing of that wound, the incision, will be unbelievable, especially after a C-section. So why isn't it? Because they're very drug and surgery oriented. There's a lot more money. Imagine me going to an orthopedic surgeon and I go, listen, you can either make tens of thousands of dollars doing the surgery or not. It's an unfair burden to put on them. It's like, are you asking them to really give up tens of thousands of dollars? But that the truth of the matter is that eventually they would want to have a bed like this in their own business. It's not for everybody in their surgical. There's some people need surgery. They just need surgery. If you have an arrow in your shoulder, we need to get that arrow out of there. Some way or another, we got to pull that arrow out. You can get in the bed all you want, ain't going to pull that arrow out. So there are other ailments that people have that need to be corrected. And then they get in the bed to actually stabilize it, to heal it, and to keep them that way. Did I answer your question? So let me tell you why it's not, it's about money. Almost 100% of the reason why it's not everywhere is because of money. However, if you go to Google Scholar, have you ever heard of Google Scholar?
Yes.
So it's scholar.google.com. And you go there and put in the word either photobiomodulation, or to make it simple, you can just put in the phrase red light therapy. And don't be surprised if you see millions of entries, millions of double-blind studies, research papers, articles, all kinds of stuff about red light therapy. And then you put in whatever you're asking about. So somebody just asked us about lupus, asked us about whatever, you put that in there. So you'd have red light therapy as a phrase, and then the ailment or issue that you have, and see what it says in regards to how it can assist you or not. And I've yet to see very many things that we have not helped.
Yeah.
So just to review,
How does it work? Like why
I'm not
is it
telling you
doing
yet.
something?
I'm going
Ah!
to make you suffer. Okay, I will tell you.
Perfect.
I want to tell you that when a person gets in the bed, they don't wear the goggles. So they just keep their eyes closed. Now, why? First of all, I'm telling you that the lights can get through your skull to the brain and help people with psychological and emotional issues, besides other things. So we see people who are almost suicidal, depressed as heck. And one lady in particular, she wrote, if this is how normal people feel every day, I can't believe I've been missing out. She's so thrilled that her life is so much better than it was. She found joy for the first time in many, many years. And the lights can actually help that. But now get to the eyes. So, people say, well, you're going to, of course, wear goggles. Well, if you wear the goggles, then you won't get that beautiful energy into your eyes. So you don't wear the goggles, just keep your eyes closed. So then the question is, you mean if I keep my eyes open, it's dangerous? No, but it's annoying. It's a very bright light. And, if I had a flashlight, I'm not going to stare into it very long before it gets annoying. So you just keep your eyes closed. If we can get through your skull, we know we can get through your eyelid. And now all the things that are in your eye, including macular degeneration, macular edema, floaters, they're simple. Within 2 weeks, the floaters are typically gone. Edema, we talked about uveitis and glaucoma and things like that. We see beautiful results with that. So the person gets in the bed, they keep their eyes closed, mouth open. Why mouth open? We want to get rid of the teeth blocking it so we can get into the mouth, gum disease, tongue, throat, tonsils, things like that. All right, are you ready to know why
Yes. I'm on the edge of my seat.
Well, that was the point. So there are two completely separate mechanisms. One of them is about fat loss. I mean, come on. I mean, I told you before that that's huge. But they didn't know in the beginning why it worked. They thought it melted the fat or something. They could see the results, but they didn't understand why it worked. Again, 50 years of studying this overall technology, and there's never been a recorded side effect. So you couldn't hurt somebody with this stuff if you tried. I've said that more than once. I got to keep hammering that in. So getting back to the one mechanism is fat loss, and the other mechanism completely different, and that's been studied for decades. As you know, the fat loss is more recent. That's been studied for many decades, and that's everything else. All the ways from the top of your head to the bottom of your feet, everything in between. You're going to see phenomenal results. And the word I'm going to use, it's hard for me to use the word healing, but you didn't hear it from me. Because if it's not drugs, they don't like using the word healing with anything. But I will tell you that if you go to Google Scholar, you'll see the research that's been done, and it's extensive. So let's talk about the fat loss part of this whole thing first. So in the world of fat loss, we're talking about a certain element of light, and it's red, only red light. Now, you know what, even before I go there, let me talk about that word infrared. So we have red and we have infrared. There is no such thing as just infrared. You're either far infrared or near infrared. Far infrared is heat. It's about delivering heat deep into the body. It has no long-lasting effect, but it's fun. You're going to have, as a chiropractor, I might want to use it far infrared to warm the body up and relax the person. But the next day, it's not going to have any long-term changes. Near infrared is the miracle wavelength or wavelengths. And then we use near infrared. And before we found out about fat loss, I only used near infrared because we know how healing, how wonderful near infrared is. In fact, that device that I was invited to learn more about 27 or something years ago was near infrared and only near infrared. Now, near infrared is invisible to the naked eye, but man, it works phenomenally well. So we're going to talk about the fat loss first, and then we're going to talk about the other stuff, the near infrared and how that, and why it's so important that you stay away from far infrared, only when it comes to lights that I'm talking about. Now, after they get treated, well, let me tell you, far infrared causing heat, what heat does is it brings more fluid to the surface of the body and would block the penetration of our light. So 8 years ago, we called it cold laser or cold treatment. They weren't literally cold, but the treatment didn't get hot. Heat is the enemy. When I take a hot pack off someone's back and it's bright red underneath, that would be the exact opposite of what we want. We don't want that redness. We don't want the blood coming to the surface because then we couldn't get much penetration of our lights. So we use cold therapy. Again, it's not literally cold, but it doesn't get hot. When someone's in our bed, it's comfortably warm only, not hot. In fact, but you can have settings for somebody that's a different size. So if the practitioner doesn't do it right, even though I train the heck and we have a whole crew training these people, but it shouldn't get hot. So there should not be any heat. So let's get back to fat loss. What they learned was that red and only red has a capability of changing the outside wall of the fat cell to become more porous. So, again, they thought it was melting the fat, and that's not what it is. So it actually creates a situation where only for a day maximum, where the fat cell walls become more porous, allowing the contents to leak out, some of the contents to leak out. And then with our unique protocol, we move the fat away from the fat cells and eventually through the lymphatic system to the liver for use or elimination. That's how simple it is. It ain't complicated. So now
crazy.
let's talk about the miracle wavelengths. So the miracle wavelengths have to do with near infrared, mostly a little bit of red, but mostly near infrared. Remember, doesn't get hot. So if you're using a device that's saying that they're good for whatever and it gets hot, you know that they're using cheap Chinese knockoff stuff. And that's what happens when you create great stuff. Someone in one of these countries is going to knock it off. It's going to look a lot like it, but it ain't the same. And it doesn't
it's
work
the $20 red light you find on Amazon that everyone's buying. Yeah.
Yeah, you can buy $4 shoes on. You can buy, a $5,000 purse for $50. It's got the same name. They have no qualms about stealing everything and anything. They don't have any rules in that country, so they can do all this stuff. And people are willing to do that. So now let's go on with the mechanism. And this is, to me, a lot more interesting. Although the fat loss is going to bring more people in than anything else, but this near infrared is the beauty. And so the near infrared they found could actually, it's an element of sunlight. So the reason why they told people hundreds of years ago to go sit out in the sun, that it would be helpful, is kind of true. Not to the extent of what we can do here. Arnett could have sat out in the sun forever. It wasn't going to change his heart and give him, get him away from getting regular heart attack. It would help overall a little bit. But what we've done is taken elements of sunlight magnify them many, many times, and then drive them deep into the body and covering the person from head to toe, and trying to affect as many cells as possible. So what they found is that this certain type of near infrared, again mimicking a sunlight element, when we affect certain cell, when the cells get exposed to this near infrared, that what they found was that the mitochondria of the body get stimulated to come back to life. So now let's talk about mitochondria. The mitochondria.
Powerhouse of a cell.
Did you read that behind me? Are you cheating? Is that what you think? But it's more than that. So it's the powerhouse of the cell. It's the reason why you breathe oxygen and eat food. It creates a molecule called, you didn't see it,
ATP. I don't know why I
ATP.
blinked on that.
And the ATP is the energy currency of the body. If you have the right amount of ATP, you're going to do much better. And if you have the lacking ATP, it will eventually lead to disease and eventually to death. So imagine if we can reverse that and get you so that your mitochondria is working the way it's supposed to. Now, interestingly enough, I'm going to go one level deeper than this. Mitochondria themselves are not sensitive to light. So they couldn't figure out exactly what's going on here. Well, it's not the mitochondria that's sensitive to light. It's an enzyme inside the mitochondria called cytochrome C oxidase. Now, cytochrome C oxidase is a chromophore. A chromophore is something in your body, a cell or a tissue or an enzyme in this case, that is sensitive to certain elements of sunlight. So there's cytochrome C oxidase within the mitochondria wall that is sensitive to the lights that we use, that stimulates the mitochondria to come back to health. And let me just tell you that when I went to school, before you were born, that we learned that there was one mitochondria in every cell in the body. Did you learn otherwise?
think they really mentioned it, but when you draw the cell, there's typically only one.
So they now realize that that's way off. And that, for example, the heart, which has the highest demand for energy, has over 5,000 mitochondria in each my heart cell. So to that end, what they learned, which is no one's going to believe this, that the mitochondria makes up 10% of your body weight. That's outrageous. When you think about it, that's pretty outrageous. It makes up 10% of your body weight. What does that mean? That means forget about bone and hair and blood and all that. The mitochondria is so prevalent in your body, it makes up that much of your body weight. So you can understand it's very important. You can understand that keeping it healthy is very important. And so there are actually books now and diseases called mitochondrial dysfunction or dysfunctional mitochondria, whatever you want to call it. So we're reversing that. We're stimulating the mitochondria to come back to health, to come back to wellness. And so that's why this thing works on every tissue of your body, conceivably, right? Nerves, muscles, tendon, ligaments, bones, joints, every organ, every gland, kidneys, easy, because they're relatively superficial, but even deep-seated tissues respond beautifully to this.
How do you know when a mitochondrial is dysfunctional?
I'm a wise guy from New York, so I've got 14 jokes going on in my head. And imagine the phone call or whatever. When someone's got a chronic disease, guaranteed their mitochondria is not functioning the way it should. So if your mitochondria is 100%, then all these things conceivably wouldn't happen. Now I'm saying something extremely controversial. So within the first year of my practice, 1978, 79, whatever, I did a class that I couldn't sustain because I didn't have the skills to maintain the answer to this. But I would teach a class that basically the theme was that sick people get sick and healthy people stay healthy. Well, no one could believe that. I mean, you're talking about a healthy person never gets sick. And conceivably, why people get sick is because their body is already weak. Why people succumb to COVID and others didn't is because their body was already weak. Now, there's exceptions to this, and I don't want to get into the argument, but this is the kind of concept that a holistic doctor, we come from a different attitude of really getting the body its wellness, its immune system. You want everything up to peak amount so you will not have these diseases. So by nature, you would think makes sense. If someone has any of the ailments I've already described and many, many others, Crohn's disease, uh, I've had people with 20 years of diarrhea, only diarrhea. And after a series of treatment, it probably took less than a month, normal bowel movements ever since. We talked about rheumatoid arthritis. We had a lady that had she was a professional dancer, then she became an instructor, dance instructor, and then she succumbed to rheumatoid arthritis. So forget about dancing. She couldn't even get her way into her home because functionally using a key was not possible for her. So she would come home, knock on her neighbor's door, who would help her into her place. And after a short period of time of using red light bed, she's not a professional dancer, but she's back to being able to dance, easily opening up the door to her place. So some people are going to have amazing, return to well-being. And some people, what we're looking for is just a much better quality of life. They're still 85 years old, let's say, like we have this lady who, the daughter contacted us. The daughter was concerned with her mother who had advanced dementia and Parkinson. So severe, especially the dementia, that she was a danger to herself and to others because she didn't remember things and she started becoming very belligerent. So they said, well, last resort, let's try the bed. Now, I want to be honest with you. This was one of our first series of beds many years ago, so we didn't know. And after just one visit, now the woman's Parkinson's was so severe that if you've ever seen anyone like this, they're rigid as a rock. They can barely, move any part of their body. So getting this woman into the bed, 85-year-old woman into the bed, was challenging. But after just that one session, getting her out of bed was relatively easy. And after a month of treatment, this woman's quality of life has gotten so great that she's completely lucid now, and she can get in and out of bed essentially she gets some help, but she can practically do it herself. I'm just reporting the news here.
Yeah.
What I'm saying is that imagine something that is safe as can be. It's not like we're saying, well, maybe we'll yank out their kidneys and see if that makes. No, we're not talking about that. We're talking about something that in all the years that this has been studied, there's never been a reported side effect. You couldn't hurt somebody if you tried. That's the third time I've said that. So give it a try. So each of
I'm curious.
you are no longer allowed to complain until you've used treatment 6 times. Go to the website, Trifecta Light, look over to the left of that page, the Contact Us page, and just request information about a location closest to you. And on the right side of that page is an opportunity to perhaps buy it. And so most of the people who are buying it are business people who want to attract a lot more people into your facility and help a lot more people. That's what I'm about. Helping as many people as I possibly can, but also thriving in this environment where you're helping people like nothing else can.
I'm curious because, I'm wondering if I know you had mentioned that, oh, we could just go outside more and, it's still not the same effect because, the infrared is, almost 1,000, sunlights going into a person. But I know most average people aren't, eating a healthy diet and then, they're not going outside. And most people, I think there was a study where it was talking about how children stay indoors more than people who are in prison. So which is crazy because they decide to stay on their devices and that's blue light going into into their eyes instead of getting
I don't have
sunlight.
an
It's
answer for I don't have an
huh,
answer for children, but I
yeah.
wanted to tell you that the reason people don't take care of themselves most often is because they're not scared enough. They don't know what they're doing today, what effect it's going to have when they're in their 70s or 80s. And, I liken, and chiropractors in general, liken well-being to a candle that burns bright all the way from the beginning to the end and then sputters out and dies. That's the way it should be. And if your last 20 years of your life, which is common, you're basically an invalid and you're basically non-functional, you can't feed yourself, you can't get around, and you can't even wipe yourself. I'm not interested in that. So I told you I'm 73 and I still work at it. but I'm not dumb here. We're not dumb here. It's not just about red light therapy. You got to eat smart and you got to exercise, not to kill yourself. The eating should be not so restrictive that you won't stay on it, but it should be a calorically neutral diet that you stay away from the obvious stuff. And smoking's a tough one. And imagine I've had people who had lung cancer and they're smoking. So there are some people, it's not just that they're scared. There's something beyond that. I don't have an answer for them. But
Mhm.
most people don't take care of themselves because they're not scared enough. So if you want to get scared, if you want to learn what your life could possibly be, go to a convalescent home and see these people that are not that old and they're non-functional. And they should all be getting in our bed. But their school, that environment is so medically oriented, so drug oriented, that it's hard for us to convert these people. But it is what it is. You don't have your audience shouldn't have a low quality of life when they get older. It's
Yeah.
the highest quality possible.
It's a
And
yes and
the
situation.
answer is red light therapy, but even more important, I will say, is what you eat, what you don't eat or drink, and smart exercise. Smart exercise shouldn't be. I get people very jazzed. I've had tens of thousands of patients, and they get crazy. Oh, I'm excited! I'm going to do it because they started in a program with me. And I tell them, look, don't get out of here. They'll say, I'm going to exercise every day, and I'm going to. Well, you know what? Then they go, I can't do it every day, and then they go, well, since I can't do it every day, they just quit. You want to integrate it into your normal life as much as you possibly can. So most people know in the exercise world, do it before your day starts. If your day has already started, there are so many reasons not to exercise because this comes up and that comes up and the kids come up. You've got to wake up 30 minutes earlier and do it before your day starts. And what you want to do is exercise as many muscles at the same time and get your heartbeat going to a set amount. You can look it up on ChatGPT. What is your resting heart rate should be, and what should you be at your exercise amount? And normally it could be like if your resting is 70 to 80, it normally goes up 30 or 40 points. And so if you're exercising and it goes up 2 points, obviously that's not enough. I've seen people, I'm at the gym and they're on the bicycle, they're going so slow and they're answering the phone and doing that. They're not exercising. I don't know what they're doing. But you want to get it to that 30 or 40 point above your resting pulse. And the pulse is so incredible. I mean, there are whole kinds of studies about the pulse. So you might want to get one of these watches that will give you what your pulse rate is. Unfortunately, it won't give you what your blood pressure is. That would be really great. But you have to use the cuff at this point.
Yeah. I
Look,
want
I
to
could
kind
go
of
on
go back
talking.
to the red light therapy, and I'm curious about um like I know it talks about how like skin can be benefited after injury or like recovery, and you were talking about even mood and stuff like that. Are there like different do you just want to do the pure near infrared for that, or is there different almost like ranges of the like light that you want to get different outcomes?
So our bed has the capability of doing a few things. In fact, what you want to look for is a bed that can customize the treatment based on their condition. So I would never shut the red off, which you can. You can have red only, you can have near infrared only. But that's a mistake. As much as I told you that red is primarily for fat loss, it has healing qualities to it. So we want the red in there. And then someone might say, well, red, I don't want to lose any weight. I don't want to, it's not like you're going to turn into a ghost. You're going to be skin and bones. What it does is it affects excessive amounts of fat, not regular fat. That's number one. So again, you're looking for number one, the most important thing is medical grade lights. So I don't mind the face masks and the helmets and all the toys that people have. They're fine. But if you want the miracles, you want high grade, medical grade lights that are very strong but don't get hot. That's where the money is. That's the challenge. And so there's all kinds of junk out there that gets hot because they're using inferior lights. Most of the devices that are out there cost twice of what ours cost. So if you get a chance, you go to the website trifectalight.com, go to the contact us page, and look at the right side where it says, check out and see if this makes sense for your business or for your home. About 5 to 10% of the people are buying it for their home because they're crazy like me. They're smart like me. I get in the bed 3 times a week. I don't have a particular ailment, but I'm looking at it as the highest quality of life I can possibly have. And I know how expensive it is to be sick. I've witnessed this with my patients. I could tell you that there is a drug out there that one dose of this drug is billed at $50,000. One dose. And the doses are usually every other week. So if you're wondering who's got the money and who's in power, it isn't the lack of using drugs, it's the using the drugs. And there's a lot of money in it. And thank God we have the drugs and surgery out there for when it's necessary. Unfortunately, sometimes and often it's used when it's not necessary, in my opinion. And avoiding drugs is what it's about, if you can. So I'm
So
not
you're
saying,
saying that your bed is able to do like it can do the red, it can do just the infrared, but then it can also like adjust the ranges of the infrared and the red?
yes, but we're not going to use the word infrared. We're going to use only near infrared.
Near infrared.
Because if you just say infrared, which there doesn't exist, there's no such thing as just infrared, it's going to cause confusion because far infrared is a different animal. It's the near infrared and red. And I suggest that you always have both on all the time. I love them. I always have both the red and the near infrared. Even though the near infrared is more healing, I wouldn't want to have a bed without the red.
Mhm.
Now, so what else
So
you're looking for is
yeah.
that the top canopy, because our lights don't burn hot, that our top canopy can come right down on the person's body. Remember, you lose power exponentially as you come away from the lights, as the lights, or I should say, the lights come away from your body. So some of these other beds that use inferior lights, their top canopy is like a high arcing arch that has like many inches between the light and your body, which is crazy, but that's a whole nother thing. And also the ability to customize. So there are 2 things we can customize, not only power, both for the red and in the infrared separately, but we can also pulse the wave. And pulsing the wave if you've heard of resonating frequencies or frequency healing, now you can incorporate frequencies with the bed as well. And so you're pulsing the wave at the same time. Now, pulsing the wave, again, with the resonating frequencies, different frequencies. My favorite is 528, 528 hertz. But we have a whole class that we give. Remember, when someone gets our bed, they get 32 things with the purchase, which is called includes all the training, all the videos, files, whatever they're going to need to be. We call it business in a box to be very successful. Did I answer your question?
Yeah, and it actually made more questions. How did the different pulses affect then the healing? Can you dive into that?
Yeah. So if as you learn more about resonating frequencies, different tissues of your body resonate with different frequencies. So what we do is we include whole body vibration with the bed. So after the person gets off the bed, they then go on the whole body vibrational unit. So now they have vibratory frequencies, we have the light frequencies, and we also include a sound generator to create sound frequencies. And again, as you learn about frequencies, resonating frequencies, pulsed waves, and things like that, you'll learn that resonating frequency is critical for the person to have better results. So there was a time our first bed could not pulse the wave, and we had good results. Once we were able to, with our research, able to pulse the wave, it took us to a whole nother level. And now the results are even better.
What does the pulse do that the light can't do?
It is a light that's pulsed. In other words, instead of the light being on constantly on, it's pulsed.
Okay.
So it's still light. It's just instead of being constant, it's being pulsed so that it will resonate with different parts of your body.
So it sounds like, let's say this might not be correct, but like for your face, let's say that you've got rosacea on your face, that might need a pulse of like 5 to where like your leg that has an injury on it may just need a pulse of 3. Is that kind of what you're saying?
Okay. It's not far from the truth, but
Okay.
you happen to be hitting skin. So that's a
Okay.
different, they're pretty much going to be similar. But, your kidneys, your liver, your brain are affected by at different frequencies. And so what we do is we have a whole class on it. It's not complicated. And to change the frequency takes 5 seconds. It's very easy. Like I said, there's the universal frequency, which is 528. All of you, if you look up 528 healing energy, it's the universal love energy. It's wonderful. And so when we come in the room, we'll go to the sound generator and we'll request that it plays 528 hertz in a loop mode, which means it plays 528 all day long. So that's the sound generator. Then the bed is going to generate the light frequency, which is set with the controller, the advanced controller that's on the bed. And so anyhow, any other questions?
Well, now I'm like, so you're putting light, which is causing healing, and then you're now doing sound, which is what does the sound do that the light doesn't do?
Sound and vibratory and light frequencies is about creating resonating frequencies with the body. So when people get on the whole body vibration, I don't know if you've ever been on one. I've been using whole body vibration for like 20 years. It's great to move the lymphatic system. So when you have vibratory frequencies, the patient will actually say, you know what, I feel it more in my back now, or I feel it more in my lungs or chest right now, based on the different frequencies that the body will respond to.
How is that different than just like someone going for a walk and getting that lymphatic flow from the walk?
Are great questions. Well, first of all, I'm an expert on fat loss. My mother was an executive of Weight Watchers, and I studied it, I watched it. And I understand fat loss better than most. So if I go to my patient, I'm going to answer this in a couple of ways, but if I go to my patient and say, okay, now we need you to go take a walk around the block. Now, I don't want to sound tough, but sometimes people who are overweight are not the most disciplined people. And they'll say, yeah, sure, I'll walk around the block, and they don't. I need to confirm that they will do this right after the treatment, because that will enhance our results, getting the blood flow, getting the lymphatic flow, and nothing moves the lymph better than the whole body vibration. So there are people that are doing it lying down with these, what look like compression pants, which is fine, but it doesn't work as well as being upright on a whole body vibrational unit. I'm in love with the whole body vibration in an upright position. Now, the ideal situation is to have a sound. I don't want to confuse you with the other sound thing, but there are high-end whole body vibrational units that use sound waves to create the vibration. Different than the other sound I was talking about, not musical sounds. We're talking about literally making the platform of the whole body vibrational unit vibrate using sound waves. So it's much smoother, it's much quieter, and can affect different parts of the body even easier. But that's a whole nother story. One day, if you want to learn more about whole body vibration, we can talk about that separately. But I just want to make sure I answer your questions. I know I've confused you a little bit because it's a lot that I've given you here. But the sound generator, we could live with. It's not the most important thing. So if I've confused you, let's put that aside. We're not going to even use it for now.
It kind of just sounds like it's like to make the healing better, and most people, just based off like habits and like behaviors, they don't tend to go and do the walk after the red light therapy, and you're just trying to enhance that.
No, but also whole body vibration is even better than any exercise out there to move the lymphatic system. So it's two things. One, I won't let them leave without using the whole body vibration. It's just 10 minutes and they're not allowed to leave. It's like you're at the dentist and he says, here, swish this in your mouth and spit it out. I don't know if this is a great analogy, but there's a part 2 of using the bed is to go to whole body vibration so that we can enhance the results. And we want to do it right then and there. So we've had facilities. I had one lady, this was years ago, before I became very insistent that everybody, after they get off the bed, get on the whole body vibration. And she put it in a separate room, which is good. But she said, there's a whole body vibrational unit over there. And if you have time, no one has time. I'm in LA. Nobody has time. If you have time, you should use it. Well, nobody was. And her results weren't as good. But after we went through her mechanism, how, all the protocol, what she was doing, we realized that we better fix this up. And we made it mandatory that everyone has to use the whole body vibration after the treatment. And the results were that much better.
Mm, that's crazy. That's awesome. Who knew that light and sound vibration could be what's helping and healing us?
But it kind of makes sense. I mean, it's certainly about light, it's sunlight.
Mhm.
And we're put on this planet. The sun is unbelievably important. That's what stimulates the mitochondria to come back to life. That's what, but we're magnifying that thousands of times and then driving it deep in the body. So you're going to get subtle results being out in the sun. There's no question about it. But you get even better results if it's, something that's really chronic and horrific. I mean, we had this one lady, she had Parkinson's, and her worst handicap, the thing that bothered her the most, which may sound silly, is that when she went to church, she couldn't hold the Bible in her hand. And it was embarrassing to her because her tremors were so severe. And then after a week or so, those tremors were much better. I mean, she still had tremors. I don't know if she's ever going to get rid of completely the tremors, but again, in some cases, we're not looking to get, would be wonderful we could, but the best thing is to get the highest quality of life for these people so they can function, so they can get out there in the world and be part of the world instead of watching the world. Most people who are that old, they're just sitting around watching daytime television and then evening television and not getting they're not having fun. I think that's a critical part of this whole thing. We want you to have fun. And again, no more complaining. If you haven't used it 6 times, 3 times a week for 2 weeks, you can't complain. Try it. If it doesn't work, I'd be very surprised.
Yeah, no, that's fair. I've loved hearing all about the red light therapy and like how it works, but since I'm a chiropractic student and I heard that you're a chiropractor, I'd love to hear you talked a little bit about your story as far as getting into red light therapy and chiropractic just a little bit, but I want to rewind just a little bit and hear how did you first get into chiropractic? Was this something that was a family friend that told you to get into it?
So my
What
girlfriend
stumbled
at the
you?
time, this was 1970. We first started dating, I was 16. And so we're talking about in 1972. By that time, I'd become familiar with her family, and her mother was, and I'll use the quote, saved by a chiropractor. I knew nothing about chiropractic at that time, nothing, in the early 72. And so then I started doing more research on it because I said, this could be exciting because, that's what I wanted. I wanted to help people and maybe get, I was sort of anti-drugs at that point already. Um, and so that's what got the stimulation going there. But the reason why I became a chiropractor is I called chiropractors all over. I never met a chiropractor that wasn't thrilled to be a chiropractor. That's what I wanted. I wanted to wake up in the morning excited about what I was about to do that day. And I loved it. It became harder as I got older. It's a very physical thing. But I loved it. I loved it for that many years, at least 40 years of my life. I loved it. And then I started getting a little burnt out and tired from it. And then I was introduced to light. In the midst of this, I was introduced to light therapy. And I pretty much dedicated my life now to helping people with light therapy. And imagine how easy, and I'm not in practice now, but if I was, imagine how difficult it is to go, Judy, go into room 3. That's where the bed is. She gets into room 3. She does her thing because she knows how to do it herself. She gets out. She waves goodbye because she's already paid in advance and scheduled in advance. And there's no physical exhaustion on my part. I mean, she's doing the work, the bed's doing the work, and I'm not. So, it doesn't have to be that way. We have a massage therapist over here in Beverly Hills. And that's a grueling job, more so even so than chiropractic. And he was 50 something years old and it was getting tough for him. And so, and his massages, um, how many can you do a day? 3, 4? No matter what you charge, you're limited. And now with the bed, he's not even there much of the time. And so he doesn't have to be there. The person gets in and out of bed themselves. So I get a kick out of this. I love it. I love the idea, the notion that we can help people get better, but we can also help businesses to be busier and make more money.
Speaking of business, I know starting something new can be really challenging. What were some early challenges that you faced when building your business?
I mean, in 1978 as a chiropractor or light therapy?
Let's go both. Let's start with chiropractic and then let's go red light.
Well, red light's the easiest thing compared to chiropractic. So there I am in 1978. And in the first year, early on in my career, I get a phone call from a medical doctor and he's threatening to call the sheriff. I said, "What's that about?" And he goes, "Well, if you treat my patient, I'm going to have to get you arrested." So this was what I was up against in the 70s. And so his patient was pregnant, and he said, "I will not allow you to risk the fetus and the mother's life with your crap," or whatever he called it. And meanwhile, he had nothing he could do for her. She had back pain. She loved the work that I was doing with her. My malpractice insurance was about $2,000 a year, and his malpractice insurance is about $250,000 a year. And you know why? This you could people don't get injured typically by chiropractic. And there are some chiropractors that are idiots out there, but basically, I never had a malpractice. I could say this without fearing jinxing because I'm out of practice, but I never had a malpractice lawsuit um, at all because it's so safe. But the challenges were people didn't know about chiropractic, or they thought it was quackery. That was very challenging. But we loved what we were doing, and the patients were giving us such great feedback. It grew itself. It was easy back then. Starting as a chiropractor now is going to be a little bit more challenging because when I started, there were 3 chiropractors in the area. And imagine by the time I retired, there was over 100 chiropractors in the same area. So one, there's a lot more competition. Two, when I started in 1978, 79, insurance paid beautifully. I mean, the co-payments were $10. The it was very easy for us to just bill the insurance, and we got paid. It was very easy back then. And it's gotten more challenging. Once they realized that chiropractic was going to be that much busier, they wanted to kick our butts, and so they really lessened what our return was going to be from the benefits that people could get with chiropractic. It got very challenging. You had to write full. We didn't have to write reports and do all that stuff. I mean, minimal. But now, you have to write an essay practically for each patient. It gets difficult. At any rate, but like I told you already, and ironically, that guy Brett that I told you is in Beverly Hills, massage therapist. Guess what? He's in chiropractic school right now.
That's awesome.
So remind me, and I'll get you his information. Give him a call.
Okay.
You say, hey, you were in massage therapy and you're doing red light therapy, and now you're going to chiropractic school, and you could say, are you crazy? But more importantly, you would say, tell me about it. And he would be a
Mhm.
great source because I've been out of chiropractic school since 1970. When did I graduate? 78, 77, something like that.
Yeah, so it's definitely different, but yeah, for sure. But I love hearing like struggles that people have had and how they got out of them. And thankfully, the perspective on chiropractic has changed a little bit as far as like the quackery
Oh,
perspective,
sure.
or because I'm in it, maybe it's a little bit different. But there are still other challenges that pop up as well.
Oh, for sure. And
Yeah.
I'm like I said, I also would be interested in helping you with that as well.
But I can definitely like feel the passion you have for like wanting to help people and like get them feeling better. And that's honestly what any patient would be looking for. But I'm curious with the work and the way that you've seen red light therapy change people and then chiropractic in general, how has your perspective changed on healing and longevity?
I mean, I don't know if that has changed. I've just become more knowledgeable, more educated. Um, but I've always wanted to help people as much as I could. Um, I what I did when I got out of chiropractic school, which I think was a big important thing, was I hired a coach. So I didn't know what I was doing. I didn't know about business. I didn't know anything. I just knew how to go to school. So I went straight from chiropractic, straight from high school to a very good 4-year college to chiropractic. And then I graduated. I was like, what do I know about business, about hiring, about any of that stuff? So I hired a coach, and that was why I did better in the beginning than most of my fellow students that I went to school with.
That's fair. So getting some guidance along the
Absolutely.
way. Yeah, that's
And I would
awesome.
also go to the Parker seminars. So if you haven't been going to what school are you going to?
Parker.
So, the Parker, especially the one in Las Vegas, the ones in Dallas, I would go to every one of those. I mean, I wish I had gone to Parker. I mean, I think that would have made a huge difference for me.
Oh yeah, I've loved going to Parker and I've really enjoyed it. Um, well, I want to respect your time and I've enjoyed so much having you on. Where can people find you and all of your like fun things? I know right now I have your book next to me. I've been diving into it and been enjoying it. So you can definitely shout out all your stuff.
So the book is Illuminated Healing. It's on Amazon. I do not make a dime off of that. Or if there were any profits, it goes to charity. So that's number one. Number two, you go to the website, trifectalight.com. And I told you before, you go to the Contact Us page. And on the left side is find an office closest to you. On the right side is perhaps buy a bed either for your home or business. And then below that is just general questions that you might want to ask that if you say, get this to Dr. Rothschild, they'll get it to me. I also wanted to mention our YouTube channel. I don't think I mentioned that before. So if you go to YouTube in general, just go to YouTube and put in the @ Trifecta Light Official, @Trifecta Light Official. And you'll see, I think it's over 130 videos now, and they're really good. So I just interviewed, we're with the NBA. So if you're an athlete or a serious athlete and you want to perform better, you get in our bed. You want to recover more thoroughly and faster, you get in our bed. So it's called Performance and Recovery. So we just interviewed the head trainer of the Los Angeles Clippers because they have our bed and they absolutely love it. We have Harry Gigliotti. His name is Harry the Hitman Gigliotti, and he is now the champion of the world in bare knuckle boxing in his weight class. And I didn't know that much about it, but this weekend, July 4th, and so it's on regular television now. And there he was, Harry Gigliotti comes out and he wins. And it's brutal. I mean, there's no gloves. So when they hit, you can see the guy going, ooh, it's really intense. But when you see, I'll send you the videos, watch Harry's videos. He seems like such a gentleman and all that. And then you see him in the ring, he's an animal. So like I
That's
said,
so
with
funny.
athletes and things like that, they will perform far superior using this. And we talked about all the other categories, the face, fat loss, the healing aspect, mental health. It's crazy that people think it's snake oil. And I have to apologize. I said, I know it sounds like that, but it is not. It
Yeah,
actually works. So go to
that's
Google Scholar and look it up. You'll see more about it.
yeah. Well, thank you again for being on the podcast. I've really enjoyed this.
My pleasure.
Thank you so much for listening to this episode of Becca Babbles podcast. If you enjoyed this episode, the best thing that you can do is leave a 5-star rating and review on Apple Podcast, Spotify, or any other listening platform of your choosing. If you want to learn more about me, you can do that by following me on Instagram at Becca Ann Wellness or by checking out my blog, freebies, offers, and newsletter on my website at beccaannwellness.com. If you want to share the love of the podcast, you can do that by taking a screenshot and sharing it on social media and tagging me and the podcast at Becca Ann Wellness and using the hashtag Becca Babbles Podcast. I hope you have a great rest of your day and I can't wait to babble with you next time.